So when we're first starting the Webster technique, we always start with the patient on the back. Robin, if you want to come over, our tables actually drop down to make it more of a safe space for a pregnant person's spine. So if you want to lay on your back right there. And remember, when we're doing Webster technique, a big part of it is checking not only the biomechanics of the pelvis, but all the muscles that attach to the pelvis. Make sure that there is proper movement, muscle tone, and everything's looking really good and healthy, not only to keep the person feeling good through the pregnancy, but also to get them ready for delivery as well. What week are you in?
So I'm actually 26 weeks today.
26 weeks. The round ligament is a very small ligament, but there's a lot of extra pressure once somebody's hitting their second and third trimester. The round ligament attaches the pelvis to the uterus, and sometimes it can be taut, creating constraint in the uterus. So it's always important to check the round ligament, make sure that there's not too much tension, both for the pregnant person, but also to make sure that there's proper space for development as well. Round ligament release is very, very, very gentle. You do not need a lot of pressure to be very effective. Accommodating for different stages of the pregnancy, but we have a pregnancy pillow that fits right there, and then a nice extra support on the head. So Robin, if you want to come start from the bottom of the table, there's a nice space for your belly and your shoulders. So I'm just going to do a little trigger point release around the spine. This is not part of the Webster technique, but it is just helpful for folks who are having back pain throughout pregnancy. So one of the most important, if not the most important adjustments during Webster technique is adjusting the sacrum and the pelvis. Biomechanics of the sacrum and the pelvis change a lot, and if they're highly dysfunctional, it can contribute to a lot of pain for the pregnant person, uterine constraint, muscle spasms, just stuff that we want to eliminate if possible. So we've already assessed Dr. Robin. Dr. Robin has a extension restriction on her right hip, and her sacrum has rotated to the left. So we're going to adjust her sacrum and her ilium. Now we're going to mobilize the spine and the rib cage, make sure there's proper movement there, and just get some nice positive sensory input into the spine. Allow her nervous system to relax. So we're going to do a cervical adjustment to Dr. Robin. She's been having some neck tension, which can happen completely normal throughout pregnancy. But when we are adjusting somebody in their third trimester, which Dr. Robin has just started, we want to be a little bit mindful about the adjustments. They're a little bit different because of the hormone relaxin flowing throughout the body, which allows the ligaments to be more relaxed. So you want to look for very specific restrictions and actually use less amplitude. We already do low amplitude, but even less in these adjustments. It's a very gentle, easy adjustment. So let's check the left side of her cervical spine. And here she has one little restriction in about C3, C4. There it is. See how much easier that movement goes. Barely any force at all. So let's check the other side. Okay, and then for left rotation, definitely a little bit more restriction and a little higher up. So you might even notice more of like a clunk sensation in this movement. But again, we're just being very gentle because her ligaments are already so lax.